Hi, I'm Lena Phileman, and this is part 2 of my case study. I first want to give a brief review of my client. He is 8 years old, diagnosed with autism spectrum disorder, and uses LAMP on an AAC device. During this past school year, he was attending school 3 days a week and came to our center 1 day a week. With it now being summer break, he is coming to our center 4 days a week. The first behavioral target is limited vocal verbal skills. Manding on his AAC device involves navigating the LAMP program to communicate his wants and needs. An example of a two-word man would be him opening the Help folder and selecting the Help icon, then opening the Me folder and selecting the Me icon. A non-example of a two-word man would be him opening the Eat folder, opening the Snack folder, then selecting the Cracker icon. In this example, we would implement an error correction procedure and teach the man eat cracker or have cracker, etc. Using his AAC device, the client is currently manding using 2 words with an average of 75% accuracy. Recently, he has been requiring gestural prompts to navigate through folders and find word icons. The second behavioral target is delayed social skills. He requires frequent prompting to engage in appropriate peer interactions. He does not currently engage in spontaneous manding to peers. Manding to peers involves gaining a peer's attention by tapping on their shoulder, saying their name, making eye contact with them, etc., making a request, and waiting for a response. An example would be tapping a peer on their shoulder, requesting for a turn on the swing, and waiting for the peer to say yes and move, or say not right now. A non-example would be standing in front of the peer on the swing and grabbing for the swing. He also does not engage in functional play with peers. Functional play with peers involves selecting an activity to be shared with one or more peers and engaging in the activity using a set of rules. For example, finding a soccer ball, standing within 10 to 15 feet of a peer, facing each other, kicking the ball towards a peer, waiting for the peer to kick the ball back, and repeating this process. A non-example is finding a soccer ball and rolling it down a slide by yourself repeatedly. Lastly, this client does not engage in parallel play. When a peer comes to play next to him, he typically gets up and moves away to another area, away from the peers. Parallel play involves engaging in play within 1 to 2 feet of one or more peers. An example of this would be one peer playing with a car, while another peer is sitting next to them 1 foot away while playing Mr. Potato Head. A non-example would be one peer playing with a car, while another peer is 10 feet away from them coloring. The third and last target is tantrums. This is the behavioral target that I will be discussing further. His tantrums are defined as crying with or without tears and must be accompanied with one of the following: throwing his body onto the ground, flailing his body or head, kicking his legs, screaming, headbanging, and or eloping. They must also occur for longer than 5 seconds to count and must stop for 5 seconds or more to count as a separate instance. An example would be crying with tears while throwing his head onto the floor and kicking his legs for 1 minute. A non-example would be crying with tears for 10 seconds. He regularly engages in a tantrum when he is not immediately given access to a tangible, or we are having him follow through with an instruction or a work task. Extinction and functional communication training has been chosen as the intervention package to reduce tantrum behaviors for this client. The intervention goals are to 1. Reduce the occurrence of tantrums. This is being measured by collecting data on the frequency of tantrums per session. And 2. Teach an appropriate replacement behavior of communication. This is being measured by collecting data on his total mands as well as each unique mand per session. As I previously mentioned, the functions of his tantrum behavior is a mixture of escape and to obtain a tangible. When the client begins to engage in a tantrum to escape a task, we have him follow through with the task. This is using negative reinforcement extinction, also referred to as escape extinction. When the client begins to engage in a tantrum to obtain a tangible, we do not allow him access to the tangible. This is using positive reinforcement extinction. Now, not only do we want to place tantrums on extinction to reduce the behavior, but we also want to teach a functional, appropriate replacement behavior, this being communication. If we observe any of his precursor behaviors, such as whining, closing his eyes, etc., we immediately prompt him to use his talker to tell us if he needs a break, needs squeezes, needs help, etc. Are these interventions evidence-based? The answer is yes. Both extinction and functional communication training are evidence-based. And that is all for this part of the case study.